When we refer to the prostate MDC, what we're talking about is a multidisciplinary clinic. That's what MDC stands for. And it's multidisciplinary because you have more than one doctor from different specialties together in the same conference room with the patient.
Ultimately, when the patient leaves the MDC, they will have a better understanding of their disease and all the treatment options and what's best for them.
Not everybody gets an MDC. MDCs are really set up for patients that do have a variety of options.
We devote about an hour's time to each patient, and they're the center of attention for all this. It's really for their benefit to answer any questions that they have. All facing a very difficult decision-making process where for early stage prostate cancer, for example, the treatments can range from just closely monitoring the cancer and just watching it to cutting out the prostate and doing a major surgical operation. And in between there's many different types of radiation therapy that can be used to control the cancer.
After the patient's been diagnosed with prostate cancer, what they'll do is they'll be sent to the multidisciplinary clinic. The time frame is usually about a month to about 6 weeks. And that's allowing the patient to heal up from the prostate biopsy. It's allowing us to order any additional tests such as bone scans, CAT scans, so that by the time they come into the multidisciplinary clinic, we have a complete, comprehensive diagnosis of the patient then, so we know exactly what treatment options we're going to give that patient on that day.
We recommend that people bring with them to the MDC whoever is close to them. That could include a spouse, close friends, other relatives, siblings. It could include their children. We find is that there is a lot of information that's given, and having support there really helps them. I think it makes them make sure that they remember all the important details, and those family members can also help guide them a little bit too. That support is extremely important for patients.
In the morning, the patient will come in. They'll be escorted to an exam room where one of the physicians will give them an exam, as well as go over a list of their allergies, medications, get their vital signs. Then we'll go ahead and bring them into our large conference room, and they'll sit with not only myself, but the radiation oncologist as well as our surgeon.
My role would be to discuss the details of the operation, whether it be an open prostatectomy or robotic prostatectomy, as well as answer the patient's questions regarding recovery, what to expect both before and after the operation. All of those things are very important, and we get into the details of all that for the patient at the MDC. The procedure, as I mentioned, takes about 2 or 3 hours. At the end of the procedure, the prostate will have been removed at that point, and the bladder is actually connected back up to the urethra, and we suture that together.
There's two main types of radiation therapy that can be used for prostate cancer. One category of treatments is to use a very high energy beam, typically a high energy X-ray beam, photons targeting the prostate gland painlessly. A very attractive different way of giving radiation is to do what's called a radioactive seed implant. It's a one-day encounter. You're in and out of the hospital, and the radioactive seeds are all put in at one time. We say that radiation and surgery are equally effective. That's based on people who are followed 5 years down the road and up to 10 years down the road.
We evaluate multiple different variables during the MDC. It's not just about their Gleason score. We also look at their PSA. We also look at their urinary function at the time when their diagnosis occurs. We also look at the whole patient. Every patient is unique, and not one set of treatment options is right for any particular patient. Because of that, we look at their background history, their medical history, all of those things that help to determine what might be best and help cure them of their cancer.
Our nurse navigator's there to take it to the next step and order whatever studies or things need to be done next.
Prior to the MDC, I've done a lot of the background work. I've looked up past medical histories on patients, certainly have pulled up CAT scans, bone scans, MRIs, anything that would be pertinent to the patient care. Afterwards, I'm helping arrange appointments for them, doing any other teaching at all, whether or not be in the surgical realm or if it's with regards to their radiation treatments, and certainly following them after their radiation or surgical treatments and seeing how they're doing afterwards.
The majority of our patients make a decision right then and there, and it really facilitates the decision-making process and definitely makes it easier for people.
When a patient leaves the MDC, we hope they feel relaxed. We hope that they feel like they are informed and that they know where their treatment's going. We offer them a lot of options, and at the end of the day, they should feel like they've gotten a complete set of all the information they need. They know which options are best for them, and they're ready to make that next step, or at least compare the important aspects of each of the different options we offer to them with all the details and knowledge that they need to make their decision.